Thanks for joining, everyone. My name is Hallie Caldwell, and I'm with Inspira Advantage. We're a consulting company that helps students or applicants going through the med school application process. We also help students who are applying to other fields within the medical umbrella. So vet school, dental, pharmacy, etc. And we specialize in helping from everything from candidacy building, helping pre-med students build their profiles to help them become very qualified candidates, to helping applicants build their applications, decide what schools to apply to, help with essay writing, secondaries, interviews, test tutoring, kind of everything that has to do with the med school application process. And we're excited to talk to you today about preparing for MMI interviews. We have two great panelists with us who are a part of our team, and I'll have them introduce themselves in just a second. See, so we're going to start, introduce ourselves, talk about MMIs, what they are, how they came to be. We'll talk about the purpose of them, how to prepare, some examples of scenarios you might encounter, how to navigate those scenarios, things to and not to do, and then we'll open up for Q&As. So if you have any questions throughout the presentation, feel free to pop your question in the Q&A box, and we'll cover those at the end of our time today. So I want to introduce our two panelists. We have Anush and Adita. Anush, do you want to go ahead and introduce yourself?
Everyone, my name's Anush. I'm a fourth year MD PhD student at Yale right now, so I'm in my PhD right now. I was born and raised in India, did high school in New Jersey, went to Boston University for college, where I was a philosophy major. And I'm really excited to be speaking with you all today.
Thanks, Anush. Adita, want to tell us a little bit about yourself?
Yeah, hi everyone. Glad to be here. I'm Aditya. So I was also born in India, but grew up in the US mainly. I went to undergrad at Duke, medical school at Mayo Clinic, and I actually just graduated kind of while I was with Inspira. So I'm actually a radiology resident right now at the Mayo Clinic as well.
Awesome. Thank you both.
Can I just say that picture of me is not representative of normal pictures that I can just to let everyone know, that is not a great picture of me. I look like I am very constipated.
Well, Anush, feel free to send over a new photo to myself or Arush, and we can get that changed on the website. All right, so we'll go ahead and jump in and just talk about what MMIs are and give you just a brief overview.
Yeah. Thanks, Holly. So I'll go ahead and start off. So just a quick overview on MMI. We'll just go through the basics, but I'm sure everyone wants to hear about the examples and the strategies. But just to start off, the MMI interview was pioneered at McMaster University. It's a Canadian university in Ontario. And then since then, it's pretty much been used by a variety of different medical students and medical schools. Unlike the traditional question-based interview where it's one-on-one, you'll go through different stations, sometimes about 6 to 8, maybe 6 to 10. This varies on the type of school. And with each station, you'll have a different interviewer and a different question to kind of tackle. Most of the time at these, you'll usually have about 5 to 8 minutes for each station. Some of them may be a little bit longer. Again, it's really school specific, but you can expect about 5 to 8 minutes. Sometimes you'll be paired with a different applicant as well, and you'll either have to work through a team, kind of go through brainstorming situations where you're going through ethical scenarios, or they may just ask personal questions about yourself. It may just be just a standard mini interview, among other things. And then next slide, please. So we'll go just quickly through the format and the purpose of the MMI. So why do medical schools use MMIs? I think Anush will talk a little bit more about this, and I'll try to chime in. And the reason why we're kind of going away from traditional interviews.
Thanks so much, Aditya. So I think the way that I like to talk about MMIs is are 7 or 8, or how many stations there are, first and last impressions. And so the reason why a lot of schools are moving away from traditional interview formats and transitioning into MMIs is because it takes away the ability of one bad interview to sink your interview day, right? And not to mention, rather than evaluating you solely on, let's say, charisma or your ability to articulate something, even though it's not what would make you an ideal future physician, the focus is really on ethical scenarios. And the idea is that if we can understand how you would respond to these scenarios, we can try and extrapolate your values, your skills, your behaviors that would then correspond very well in your future career, hopefully. So in terms of the best qualities that really the MMI is looking for, and it really allows you to come through with interpersonal skills. There are team-based stations where you can communicate with people, adaptability. Sometimes MMI, some stations might apply the teeniest bit of stress on you. So they may maybe just not respond and let you drive conversation. And the goal is, how do you adapt to a slightly stressful situation with a person in that particular sitting across from you, and you have to drive the conversation. Teamwork, as I mentioned, goes well with interpersonal skills. Critical thinking, a lot of these sometimes might give you statements to evaluate, and then the goal is to help you understand kind of how you would structure and logically analyze what's presented to you. Compassion, of course, empathy, right? Probably one of the most important characteristics going into the medical profession. Oral communication and resilience, which also, I guess, ties well with adaptability.
All right, we'll move on to the next slide here. Talk about just a little bit more about MMIs and what they're really trying to get to the root of.
Yeah, so again, as what Anush had said, it's kind of a little bit of in some ways, it's a little bit of a safer interview day. You don't have just one interview that could make or break your performance. It's about, from the perspective of an admissions counselor, and the admissions committee of a medical school, it's really about limiting biases and trying to understand a person in as many contexts as they can. One thing that we're going to try to emphasize throughout this presentation is that it's never about getting the right answer. I know that's a lot of intimidation about a lot of these scenarios, especially as we give examples of what they are. They're more interested in the how instead of the what you said, right? Because they know these are tough situations. They know they're trying to put you on the spot, back you into a corner, and they're just trying to see how you respond in those sort of situations. And if you think about it, you have 8 different opportunities to kind of give a first impression. You know, even if in a 20 or 30-minute interview, the interviewer will kind of get a sense of who you are within the first 1 to 2 minutes, right? So if every station is 5 to 8 minutes, you have 8 first impressions that you can give. And if you didn't like one of them, you have 7 more times to try and redeem yourself. And again, it's about performance under pressure, light pressure, but you know, it's enough to kind of really understand who you are as a person and what instincts you lean towards in those situations.
Great. All right, let's talk a little bit more about preparing for MMIs.
Yeah, so it's really, really important when you're thinking about MMIs, do your research, right? Just because these are ethical scenarios doesn't mean that you can't sprinkle in information about what you really enjoy about a school. Maybe there's an ethical scenario that deals with how would you empathize with a certain patient? And maybe that particular school has a longitudinal course curriculum that's built around working on your oral communication skills. That's a great place to smatter in not just how you'd handle that situation, but how you can improve towards that goal at the school that you're interviewing for. Current issues in the medical world, of course, I mean, these are all kind of current affairs that you can smatter and kind of sprinkle into your conversations. It adds a spontaneity component to the conversation, but it also makes you seem a lot more knowledgeable, which I'm sure you are, but it makes you seem a lot more knowledgeable about what it is that you're talking about. Mock interviewing is the best prep method without a doubt. It's really hard to gauge how difficult it is to keep your composure against, especially in virtual settings now where a lot of interviews are, unless you give it a go. It's really hard to know, all right, if I have this amount of time to try and prep an answer and then this amount of time to speak, you realize how long 5 to 8 minutes really is when you give it a go. And so just practicing can help you speed up the ability to logically shape your answers. Practice makes perfect. Exactly. Practice, practice, practice. There's a whole bunch of online databases that give really great questions. And nonverbal communication. This is something that I really mention, especially in a virtual setting. Take your enthusiasm and turn it to 11. Okay, because in a virtual setting, it's already difficult for people to be able to gauge a lot of your nonverbal communication elements, and body language matters so much. So make yourself seem so enthusiastic with everything, just very bubbly and you know, whatever it is to kind of get across your passion for medicine and for really interviewing at that school.
Aditya, do you have anything to add to this slide? Any other thoughts that come to mind? Oh, I think you're on mute here.
Sorry, I was hoping I would not do that, but I'm starting to look a little old. I promise to know how to use Zoom. But yeah, one thing that I was thinking of was I guess one of the strategies, and there's a question in the chat right now about how to like stay up to date on all these like medical topics. There's two strategies to this. Obviously, you can be very well read, and you know, obviously that would be the most ideal thing. But if you are not able to have the capacity to like read up on everything, they're not expecting you to. It's good to have like a couple of key stories that you have, but try to figure out ways that their question can relate to it, right? So instead of trying to understand or like prepare questions or answers to questions, just prepare stories. Like, what is your story, right? If you were to tell me 5 stories, like 5 chapters in the book of your life, what would they be in terms of being a doctor, right? And then see if you can mold the questions to those chapters, right? So see if you can kind of mold the question to the answers that you've already had. And again, we'll kind of go through this a little bit later in the presentation.
Fantastic. All right. I think this is what everyone's anxious for. Let's talk a little bit about common stations and scenarios, and we'll go through how to think about some of these.
Yeah, exactly. So yeah, I'm sure this is what everyone is like definitely very keen on understanding, and I'll try to give some examples along the way as well. So the MMI stations, like, so for example, when I was even going through this as a medical student, I thought I knew exactly what they would throw at me, but there was always something else. Every single MMI I went through, I was like, okay, I did not expect that they would do that, right? But the point is to not be prepared for everything, is just to kind of be open. And like, again, it's about showing how you're thinking. Like, that is the most important thing about these scenarios, is verbalizing, okay, this is what I'm thinking right now. This is how I'm going to strategize going through the question. But some common scenarios that do happen in the MMI that you can at least kind of prepare for is sometimes you may have actor situations. These are like patient actors. For example, one that comes to mind right now, you'll walk into a room and there'll be an old lady there, right? Someone who's pretending to be a 70-year-old lady. And the scenario is you just told that lady that she has Alzheimer's, right? And she starts breaking down and crying in front of you, right? And the evaluator's just in the corner evaluating, okay, tell me how are you going to comfort this patient right now, right? There'll be little scenarios like that, right? So if there's, that can generally be you're breaking bad news to a patient. How do you comfort and console them in those situations? I've come across stations where you are writing an essay. This could be, you know, literally tell me why you want to be a doctor again, but this time you only have 5 to 8 minutes to say that instead of months to prepare a personal statement. I've come across scenarios where you have a picture, right? And they just want you to describe what's in the picture, right? It can, and you don't really know what they're looking for, but you just have to kind of go for it and try to show that you're thinking about it as deeply as you can. You can have a standard interview, 5 to 8 minutes of just tell me who you are. You can have a teamwork station where there are 2 applicants who are tasked with building something together or working on a certain scenario. Ethical scenarios are probably going to be the most common, whereas just the interviewer and you and the interviewer says, okay, tell me, what would you do in this situation if a patient asked you this, or if a patient did this, or if you saw your physician colleague doing something that you didn't agree with, how would you deal with that situation? Someone will have a rest station. I feel like that's pretty self-explanatory. And then again, they'll just sometimes have questions to throw you off. And yeah, if you could be an animal, I was trying to think of something off the spot, but yes, things like that. If you could be an animal, what would it be, right? If you could have, what would your last meal be if you knew that your last meal would be tomorrow, right? Just random things, right? But again, it's about just have fun with it. Have fun with it and just stick to your answer. That's kind of what it's more about, instead of picking one thing or the other.
Anish, do you have anything to add here? I know this is a content heavy slide, but if you have any thoughts, feel free to add them.
Yeah, just a super couple of quick points. I did gave some really great advice on this slide. Just a couple of other things that I would maybe add on is, first of all, the station with actors. This is like a highly, I think, underemphasized tip. These are trained actors. So for 8 minutes, they can take you through a heart-wrenching kind of episode of someone's breaking down, and you start to really feel. And then it's end scene, and they just say smile, and they just smile and say thank you. And you have to make sure you can wipe yourself off and then go to the next one and be ready for whatever the next situation is. So practice that. Practice compartmentalizing those 7 or 8 minutes so that when you go to the next station, you're kind of prepared. Some of these can be really, really kind of heart-wrenching, heartbreaking scenarios with amazing acting performances. And it's really hard to sometimes keep your composure. The other thing that I would just want to quickly add, with the quirky, outlandish questions, the goal is to really to see how you think. So you can give any animal, you can talk about any last meal, but if someone said, what would be my last meal? I'd have to be a good Indian son and say something like my mom's cooking or something, right? Because it means a lot in terms of the values that I come from, what I prioritize. And that's really what the person across from me wants to hear. What do you care about? How do you think about things, right? What do you prioritize in terms of what you're looking for here? So that's really how I would try to think about these things. And one last quick point, the standard interview station, a lot of people when they're going into MMIs, think that I don't really have to worry about the why medicine, why this school, these kind of questions. These can absolutely show up in your standard interview stations. It might be a shortened, bite-sized standard interview, but I would still know the classics. I would know the hits. Why medicine? What do you see for 15 years? Those kind of questions.
Awesome. Thank you for that. All right. I think the next 2 slides, we're going to talk a little bit about the framework of how to approach each of these stations and you're working your way through them.
So the framework is really, really important when you are, this is really what you want to do when you have how much of your time the school gives you, and it varies between schools. And there's also policy changes on whether or not you might have access to the questions when you actually enter the MMI or not after the reading period. But yes, read the prompt twice, as many times. Sometimes they're complex, sometimes there's layers to it. Start your response with a sentence that indicates you read the prompt and show your enthusiasm. So the way that I recommend is, hi, my name's Anush. It's really nice to meet you today. And I'm really thrilled to talk to you about the ethical underpinnings of, I don't know, science, medical communication in pandemic times, something like that, right? Where you're not exactly saying the question again. You're telling me what you think is really interesting about it. But I know that you've read the question, and I know you've thought about the question this time. Consider the prompts from all sides. Consider every single party involved, how they're thinking, what they need. Another thing that I always recommend is always be kind on every person, right? You have the right to say an action is wrong. Don't say a person is bad or evil or problematic. Focus on the action, not on the person. And so, you might have, for example, you might have a case where someone says there is a person spreading misinformation about the COVID vaccine. Well, that person's probably trying from their perspective to look out for their community. And there's been a miscommunication on how well science and medicine has been able to communicate the importance of the vaccine to all the communities involved. But the fact is that person isn't bad. They just have a misunderstanding potentially of what the vaccine does. So it's just really important to think about, don't attack a person when you're thinking about all perspectives from for all the parties involved. And ask clarifying questions, consider the choices of consequences, take a stance. So discuss all the perspectives, take a stance, and then elaborate on that stance. And here's where in the elaboration, you can bring in your personal stories, as Aditya was talking about. You can bring in things that you know about the broader perspective within medicine. Those are really the best places to kind of incorporate those things into what you're saying.
Great, thank you so much. Aditya, do you have anything to add before we move on to the next things to think about while walking through these?
I not for this slide. I think we're continuing on kind of with the framework, so I can go ahead and add on that.
All right.
So kind of following off what Anush said. So again, like I do really like his point about it's not the person that's wrong, but and the thing I'm going to add to that is part of the strategy of the MMIs, again, is just thinking out loud, right? And just like practicing the skill of thinking out loud coherently. Because they're not asking for you to have the right answer. They're asking to see how you think about these things. So for example, in that situation that Anush had said, you can say, I don't necessarily agree with that person's view on the vaccine, but I can understand perhaps why they think that, right? Because they have different information streams, because they might have been relying on anecdotal data, right? Like they may not be from the medical field, and medical literature just means nothing to them, right? And that's something I have to be cognizant of, right? But even if that's the case, I would still try my best to, have a discussion with them about saying, like these vaccines are necessary, or these vaccines are things that would help you out. And even again, what I just said, that is literally how I would answer these questions in the MMI, where it's like, I kind of go through my thought process. I can see why their side is valid. I can see why they think the way they do, but this is where my opinion is coming from. And again, that also kind of helps with saying, like, showing what the conflict is and the issue, like, and any ethical considerations. Like, again, you don't have to be very definite about making a decision one way or the other, but you can show, okay, I'm leaning towards one decision because of these things that are happening. And again, like, in that response, you can talk about, part of the ethical consideration is which do you try to convince the patient more of? Is it more of self-autonomy versus public health? Like which pillar is the one that you should be relying on more as a physician? Compassion, again, is something that can be really easy to incorporate if you rely on the strategy of, I see both sides. Like, you kind of play devil's advocate. Like, this is what I think, but I do understand where they're coming from, right? And just the fact that I'm able to show it and emphasize that I understand what their thought process shows that I have compassion for that side, instead of saying I completely disagree with whatever they're saying or what the patient is saying. They should be doing this. I don't know why they're doing this. That obviously comes off as a very different tone. So always kind of talk about all perspectives. And I know it will sound it will sound like you're kind of beating around the bush or kind of dancing around the question, and that's okay, because they're kind of, again, they're interested in seeing how you dance, not seeing where you end up. So, but at the end, if you want to conclude, you can kind of say, okay, like, even though I've considered all these sides, this is where I'm kind of ending up. This is where I'm kind of leaning towards in this sort of situation. I'll give one more example because I think those are very helpful in kind of in solidifying these points. One question that I came across was, I'm caring for a patient. They've had severe weight loss in the past 3 months. They've ended up in the hospital. Okay. I found out through the biopsy results that they have cancer. I haven't told anyone yet. I'm about to go tell the patient. The patient's family pulls me aside and says, hey, can you not tell the patient that they have cancer? I don't know if they'll be able to deal with that. Can you just tell us? Right. And so so first, define the conflict or the issue. What is the conflict or the issue in that situation? The conflict is the person that I'm directly caring for, the patient, has a serious medical condition that I'm obligated to disclose. However, the family members don't want me to do that. What are the ethical considerations to consider? Well, again, that's where I kind of go into saying what their side is and how I understand it. Well, so I can say from my perspective as a physician, I am taught, and I went into this field to care for patients, right? I like every decision that I make for the patient needs to be discussed for the patient. That's what I was taught. That's what I was taught. But I do understand their concern, right? Their concern is this is a very serious medical scenario that's happened. We don't know how the patient is going to be able to handle it, right? But is it necessarily the right thing to do to tell the family first? I can understand where their concern is coming from, right? But what is it that I should do as a physician in this case? If it were ideally up to me, perhaps I would tell the patient first. Maybe the way that I can kind of straddle the situation is to first ask the patient, what is their preference, right? Keep I focus on the patient first, because that's who I'm caring for. Would the patient be willing to know what the diagnosis is? If the patient also agrees they don't want to know what the diagnosis is, then perhaps the problem is solved, right? The patient agrees with the family's decision, and hopefully everyone's on the same page. If the patient does agree that they want to know what the diagnosis is, I think in that situation, I will ultimately end up telling the patient. And that's just because that is how I'm taught to be a physician. I'm caring for the patient. If the patient wants to know, that is their right to know, right? Just because the family says different, perhaps that's not something I can really rely on as much. So, and I know I'm taking a lot of time on this slide, but I just wanted to kind of go through the whole thing. I went through the conflict. What are the ethical considerations? I've shown compassion first. I usually go for the opposing side first in that situation. I understand where they're coming from. I understand why they're doing the thing that they're doing, but this is what I need to do as a physician. I need to remember I'm a physician. I'm taking care of this patient. What does the patient want? And if it's congruent with the family, great. If it isn't, I'm going to have to side with the patient. And that's kind of how I go through the entire situation.
Great, thank you for that example. Anush, do you have anything else to add to this slide? Any examples that you want to add?
Yeah, two super quick points. So one point, just to build off of what Aditya was saying, there's a lot of kind of key concepts like patient autonomy and non-maleficence and so on. University of Washington has a fantastic free bioethics, medical ethics resource online, which kind of spells out each of these principles, what they encompass. It's, I think, a must read before you go into either like Casper, MMI, anything that's ethical scenario based. It's just a fantastic way to get acquainted with these core kind of medical ethics principles. And the other thing that I just wanted to also build off what Aditya was saying is that you might take a stance, and just keep in mind, if your MMI kind of evaluator is asked to be particularly adversarial in that moment, they might push back, and they may say things like, well, are you caring about the family's opinion here? I mean, they're obviously worried about the person. At that point, it takes a lot to not waffle, not just start getting shaky and being like, well, I see your point. It's totally fine to say, I hear where you're coming from, but here's why I still think that patient autonomy is the supreme kind of guideline in this case, where the patient has to make the decision because my obligation is to the patient first. So just remember that, right? You might have pushback, but really stick to your guns on this one, because you whatever your viewpoint are, if you're logically reasoning it out, you have a reason for it, and you should really stick to it.
Fantastic. All right, let's move on to kind of standard do's and don'ts. We'll start with things to make sure you do in your interview.
This is, of course, classic, right? So wear your appropriate professional attire, very important, of course. Medicine is really based around professionalism in a lot of ways. So it's very important to showcase that. Probably don't wear a hoodie like I'm wearing right now is basically the point I'm trying to make. Look at everything from all point of views, exactly as we emphasized already. Understand the MMI structure, and a lot of that comes from practicing. There are fantastic YouTube tutorials, especially from Canadian medical schools, including McMaster, but also others. McGill has a fantastic kind of set of YouTube videos where they kind of give you even examples of stations and how you maybe want to role play or talk through those stations. Great things to look up and just understand what you're up against. Be friendly. Smile is great. Smile. Be enthusiastic. Hi, it's really nice to meet you. At the end of every station, even if they cut you off because you ran out of time, thank you so much for your time. And then you move on, right? Those small things make a big difference. Greet and say goodbye to each interviewer. Ask for clarification if needed. Completely fine to say that. Completely fine to say, could I have a few seconds to just think about some other questions that I have that arose from this fantastic point that you just made? That's completely fine as well. Read the prompts twice, actively listen. That's all very important, especially actively listen if you are in a particular station with an actor across from you, because the information that they're providing are cues. An actor might say something, I think you talked about a person who might be an elderly individual, a geriatric patient who has just been told that they have Alzheimer's. They might be really sad and saying, I didn't know that this could happen to me. That's your cue to stay on that and try and elicit how they're feeling in that moment. Instead of saying, well, let's talk about next steps. Let's talk about what your next options are. Let's talk about what happens since I just told you we're diagnosed with Alzheimer's. They're obviously giving you an emotional cue. Actively listen to that. Process what they need in that situation. What they need right now is for someone to listen, what they're going through, what they're processing, how they're feeling about what they're feeling. So take the time to kind of listen and understand cues, especially coming from actors or teammates in team-based scenarios. Always demonstrate empathy and compassion, always first and foremost. And yes, be on time. That's part of professionalism. Please don't be late. As I said, it's 8 first and last impressions. and all 8 will suck if you're late. So try and be on time.
Great. Adita, anything to add to these do's and don'ts, or do's
Yeah.
or get to the
Yeah.
don'ts?
Yeah, and to clarify, so yeah, obviously, like, yeah, don't be late, and be on time, and wear everything that's appropriate and be professional. Just to clarify, the way these MMIs work is like, I think once you're in the MMI session, hopefully you don't have to like walk around the entire campus to get to the next section, because there's only like 2-3 minute breaks. So like once you're at one station, it'll probably be like a series of rooms, and you'll just kind of go around, right? But when they tell you you may enter the room, just enter the room, right? Like whatever the instructions are, whatever the house rules are, just be ready for those. Some of them may want you to allow you to write, some of them may not allow you to write, some of them may allow you to see the prompt again, some of them may not, right? So you just have to be prepared for everything, and whatever it is, you go with the flow and just trust your gut, and again, just show what you think. And that's the most important thing.
All right, we'll move on to some don'ts, and then after that, we'll jump into a few Q&As.
So again, I think these are all pretty obvious about what not to do, like an interview to med school, whether it's this or like a first date or anything, it's all kind of the same rules. Don't talk over the other person. Don't try to interrupt them if they're giving you information, try to understand it correctly, and then you can always try to like reverb it back and say, okay, I think I'm understanding you correctly. Is this it? You're allowed to ask questions during these MMIs if you feel necessary. Don't try to second guess yourself too much. It's not about getting the right answer. If you feel like you've come up with a stance and they press you on it, it's not the time to flip. Like, try and really defend what you're saying, and again, give good reasons. There's a reason you're saying the things you're saying. Just stick to your guns and you should be okay. Neglect someone's POV. I think both of us, Anush and I, have said pretty like strongly, again, it's all about considering both sides. Play devil's advocate. I can see why they're thinking the way that they're thinking, but this is why I'm thinking the way I'm thinking, right? Never say their way is completely wrong. Everyone has a reason for the way that they're thinking, and if you show that you understand that reason, that's a huge plus. And again, it's also about compartmentalizing. You may mess up one station, totally fine. There was one station I remember. I still remember it. It's been, gosh, I don't even know. It's been like maybe 6, 7, 8 years. I still remember the station. I messed up completely and I got chewed out. I thought, oh my God, I'm not, like, the rest of these interviews are going to go terrible. But I kept going along and I ended up getting an acceptance to that school, right? So you just got to take it on the show. You got to take it on the chin and keep going. One thing is not going to mess up the rest of them, or don't try to let it. And I'm probably doing this one right now. Don't start rambling to fill up more time, right? Just be succinct and to the point and keep things going. All right, Hallie, next.
All right, actually, that's it. So we're up to Q&As now. So if you have anyone has any questions, feel free to pop them in the Q&A. One we have right now is, do you have any suggestions for specific sources to stay constantly up to date on current topics in medicine, podcasts, email digests, etc.?
Yeah. So I think Anush had said one already, specifically for bioethics. I think, if you want to like get a more familiar about those principles, so that you at least have like standardized reasons for why you do something versus the other in these scenarios, I think that would be a very good one to check out, right? It's like no one can fault you for saying, one of the things I was taught as a physician was patients have the autonomy to know what they want to know, right? And that's what I'm sticking to. No one can fault you for that. That is how we are raised as doctors. Other things that you can do for more general things, you don't have to read every single journal article and everything like that. I mean, there's certain sites like Doximity that do have like kind of like highlight articles that pop up if that's something you want to go on. You can also do again, like the strategy that I did was I came up with about 5 to 6 key stories, and I tried to flexibly apply every question to the answer that I already kind of made, right? So you can also kind of do the same thing with topics, right? You have a bunch of 5 or 6 key topics that are upcoming in primary care, for example, right? Like the shortage of primary care physicians is a big one, right? That might be one thing, right? The state of healthcare, right? That's always in flux, something that's happening there. Medicare, right? There's these topics that are very talked about. Even if you know enough knowledge to kind of come up with a thought process, that's enough. You don't need to know how Medicare works. You don't need to know when the next physician reimbursement cut is, but you need to know that it's a big deal, right? And people are concerned about where Medicare is going, right? And if you know that much, at least you can kind of hopefully come up with an answer that seems coherent.
Awesome, thank you. Someone asked if they can start asking questions regarding residency interviews and applications. And yeah, I think if you have a question, feel free to pop it in and we can definitely cover it with any time that we have.
Yeah, I'm happy to answer any.
I'm not qualified, so you don't want to hear those answers from me. Just wouldn't go well for you.
All right, we'll give it another minute or two for some more questions to pop in. In the meantime, Anush or Adita, do you want to talk a little bit about how kind of how these interviews are graded after the fact, and if there's like any specific strategy that you want to go in with?
And everyone just kind of takes advantage of it. That could be you have a busy practice, your patient at 11 a.m. no showed, right? And then all of a sudden he comes at 3 and he's like, can I please get an appointment today? Like I need to be seen today by this doctor. I'm sorry I missed at 11. What would you do? You have patients all the way till 5 already booked, but this patient was scheduled for today, but he didn't come at the right time. What would you do in this case? And again, there's no right or wrong answer. If you decide to say, I'm sorry, I can't see you today, perfectly fine, but you need to explain why. If you decide to say, I will see you today after all my other patients, perfectly fine, but again, you need to explain why you're doing that.
Also, I think there's a couple of questions in the chat, so we could take one at a time. The first question is, would there be a combination of traditional interviews and MMIs, or usually one or the other? Which is a great question. It can be both. So, for example, schools like Wayne State do traditional as well as MMIs. Some schools like NYU have a predominantly MMI-based interview setup, and then other schools have traditional interviews. Now, actually, like for example, at Yale, the interview has become where you have a traditional interview, but the traditional interview actually has ethical pieces rolled into the interview format. So you might not have a full MMI setup, but being able to know how to address ethical scenarios will play an important role even in traditional interviews. They start popping up just in terms of how they would kind of ask a lot of the traditional questions. They instead replace that with an ethical scenario question. Those are all really, really useful.
Yeah, and the other way that this could work is one of the stations could just be a 5 to 8 minute traditional interview. Tell me about yourself. And then the second question is, I'm currently a physician assistant and went back to medical school. During interviews, I was trying to balance having a knowledge base versus not being arrogant and a know-it-all. And again, this is again a very tricky thing, because obviously we want to prepare and know everything, right? I think just think about the way I like to think about these is it's like you're having coffee with a friend. It's a little bit of a high stakes coffee with a friend, but that's how I kind of like to approach these, right? It's like I'm talking to a long lost friend. Do I want to tell my friend everything that I know, or do I just want to just have a casual conversation about a relevant topic? So that's kind of how I go about that. And again, if you just kind of go in with the mindset of they are just looking to see how you think instead of what you think, that'll hopefully help as well. So if it's really hard to be arrogant if you focus more on just verbalizing your entire thought process.
Yeah, I just want to build off what you just said, which I think is really great. If you want to not seem arrogant, you can always say, I believe, in my opinion. This is what I think, but absolutely, please do let me know if there's different opinions. If you come in with the idea that you're humble, you're open to learning and how you frame your responses, and you phrase everything as much as possible from a personal lens, I believe, in my opinion. Avoid saying things like, well, this seems like this is obviously the right answer, or this is the way that everyone should think about, or people should think about it. That's when it starts to become preachy and it starts to sound a little bit arrogant and become problematic. Reference yourself and your own beliefs and opinions, and you really shouldn't run into that problem.
Covered the questions that we have. Anusha, Adita, is there anything else that you think we haven't covered that we should touch upon before we wrap up? Any words of advice?
Yeah, again, my strategy has been like picking 4 to 6 key stories and then trying to see how you can morph everything to those stories. So for example, like for example, like I'll have a question, I'll have a scenario of research, a scenario of volunteering or whatever. And then one of the questions will be, when is a scenario that you were proven wrong, right? Okay, so that's my question now. I have 4 to 6 stories where I should be able to find somewhere in one of those stories I made a mistake or I thought something that wasn't true, and then just pluck it because you've rehearsed those stories and use it to answer the question.
Yeah, and absolutely, it's a very, very similar point that I have. It's just that always consider and really introspect on what that story means to you. Like, what are the values embedded within it? So not just what happened, but what does it mean for who you are as a person, how you approach problems, how you think about things. Really, really go in depth with the thought process. And the only other word of advice I'd give is really try and stay composed. I promise. I think I gave an example where he went in and he bombed a station, or he thought he bombed a station, and he got an acceptance at the school. I had similar experiences a couple of times where there was a pressure interviewer and they were pushing back, and I felt my self-confidence crumble when I left that station, and things worked out. I got acceptances. What they're looking for is how you respond. How do you respond to pressure and so on? So just understand that really, when you leave, how you feel is a really bad metric of how well it went. So keep your composure during the interview and just take it easy. Once you prepare and you practice, I assure you'll probably always do better than you think you did.
Yeah.
Great.
It looks like we have one more question. Hallie, go ahead.
Yeah, I was just gonna say we have another question. Should any step failures be mentioned on personal statements or MSPEs, Dean's letters, or MMIs the time to kind of bring up other parts of your application?
So I guess this one can be a little tricky. You don't necessarily want to bring up this this failure like out in the front if there was like no question to prompt it. If there is a section within the application where they ask, okay, were there any additional hardships or things that you want to mention, that might be the best time to do it. I would probably stray away from making it the entire focus of your personal statement unless there's like a bigger story to it. Like there was like so much adversity and a lot of things that went wrong because of external circumstances, but you were able to come around and you still want to go to medical school. But like just kind of focusing just on on step failure for the personal statement, again, like that is like kind of like your ticket into the door, and you don't really want you want them to kind of know you as a person and understand what are the good qualities, and your qualities are that good that it's okay that you had the step failure. We understand what happened. Like that's kind of how you want them to look at it.
I think something else we talked about in our webinar just on interviews overall for medical school was that once you're in this interview phase, there's no doubt about your qualifications. You shouldn't be worried about your grades, about your personal statement, those things. Once you get to the interview, it's really about finding fit and see how you fit in with the school, what they're looking for with a certain class. So it sounds like it's kind of the best idea to focus on the problems in front of you. If you have an opportunity to address it, go ahead, but don't make it the focus. Does that sound accurate?
Yeah, I do agree with that. I think when you're at the interview stage, you've hit the metrics, and you just gotta shine as a person. So whatever they're throwing in front of you, focus on that.
Yeah, the goal is never to have a sob story, right? It's to have something that is a springboard to showcase resilience. So this thing happened to me, and this is how I moved past it, and this is how I can assure you that it'll never happen again from a med school perspective, right? So the goal is really to show you can have faced adversity, have faced hardships, but the focus is what did you learn from it and how does it shape you as a person? So yeah, it should never be just like again, I can't speak from a residency standpoint, from a med school standpoint, it's never a list of excuses. It's really a focus on who you are, what you believe in, and maybe things that have shaped that, that have happened to you.
Fantastic. All right, we'll give folks just another minute to pop in any last minute questions. But I want to say thank you to both Anush and Aditya. I really appreciate both of you being here. You gave some really great advice, and I'm sure I learned a lot. I'm sure other people did as well. And to everyone who joined, thank you so much. You'll get an email with a recording of this webinar in the coming days, but feel free to reach out to our team. We're happy to help. We can have a free consultation to go over any thoughts that you have, any questions that you have. And we're here to help you. Aditya and Anush are on our team and here to help. So definitely keep us in mind. All right, well, we'll wrap it up then. Thanks, everyone. I hope you all have a great night. And we'll hope to hear from you soon.
Thanks, everyone. Take care.
Thanks so much, everyone. Have a good night.